You know, this sparked up a lot of things for so many people in this country. In fact, I heard so many people also say, wait a minute, that means that for over 50 years of the country, maybe looking down on itself in terms of our capability, the indigenous professional, wherever they are in this country, who may not have believed in themselves, this certification actually validates all of those, saying, well,
you know, Chimbi,
well done, Nigeria.
I told myself yesterday when we were declared free, I said, if Nigeria can win Ebola, then I can win a Nobel laureate. I can just become a Nobel laureate. It means I can be anything. Because the truth about it is, the very first time the Patrick Sawyer thing started, it was with fear. And I just thought of it that, oh, this thing has entered Nigeria. How are we going to do it? With the Boko Haram issues, with the kidnappings, you know, we have a lot of issues that we are even battling with. And I just thought of it, oh, no, not now. Not Ebola. And then we saw how these issues were responded to. Federal government, local government, Lagos State government, the River State, the surveillance team, the epidemiological team, the community mobilization team, everybody came in together. Everybody wanted to, for once people volunteered, people wanted to help. And now another thing that I really saw was the private sector participation. So many private sector, you know, there was funds, there was donation, people donated, you know, PEPs, people donated a lot of things. They just wanted to get involved. And that also goes back to say, you know, when people talk about primary health care, I want to give you an example. Using the family planning, many times when they say the family planning, the percentage of women in the reproductive ages that are in one form of family planning method or the other is about 9.8%. And the percentage of women that actually have unmet need for family planning, i.e. these are women that do not want to get pregnant but are not using any form of family planning method, is about 16%. And I say for a country of 178 million people thereabouts, that is very low. But now we think of the social marketing. If you ask the person on the streets, the person is saying they want me to do family planning because they want to reduce the number of children I want to give birth to. They want to reduce our population. That is the mindset of people. So why can't we for once say family planning can actually reduce maternal mortality by about 23%? So if indeed we want to reduce our maternal mortality index from 560 that it was at the end of 2013 to about 300, which is the benchmark for the Millennium Development Goal, then why can't we just put social marketing in it? Why can't we make this women to see that really when you do family planning, you would be reducing the maternal death by 23%. Putting it in the local perspective that they can understand. Letting them know that when you are alive, you'll be able to take care of your children. When these children are well taken care of, they'll grow up to be able to take care of you. So the way it is, the mindset of Nigerians, they can't be blamed.
And you know, in all of this, you need an effective public health institutions.
Yes.
So how can we really sustain that? Because before now, we've always talked about a lack in that.
Yes, for me, one thing I realized with public health institutions is I read dentistry when I was in school, and then I did my master's in public health. One of the things, when I started working in the communities, one of the things I saw is that lack of communication. You know, there was a time I went for a school health program. This was in a remote area in Badagry. As at the time we got there, we could perceive the odor of palm kernel. You know, that was how remote that area is. And then eventually we saw, after getting to see the students, the pupils and all, and then they were sharing flyers to talk about the things you should eat to prevent malnutrition. And then I saw lettuce, I saw chicken, I saw, you know, and then I asked the director that, you can't bring this to this kind of community. This is a community where you have crayfish. This is a community where you have palm kernel. This is a community where you have, why not just put things that they can associate with? When you put crayfish there, they can say, oh, if I take this, I can be healthy. Why not?
So
we have it in our community. Things within the environment, the local resources that they can identify with. And that is where the message design comes in. One area of public health that we need to really work on is message design. We have a lot of donor agencies coming into Nigeria. Many times they want to help the communities. But these communities that they want to help are seen as the victims. Now, when you see me as a victim, there's a sense of, oh, you're doing something for me. And that means most likely when you leave, I see it as your project. I don't see it as my project. And because I don't see it as my project, the probability of it being sustained is very low. There is no community ownership. Community participation is low. But a situation where you come to meet me, what are the kind of foods that you eat in this area? I can tell you, we take crayfish, we take this, we take ewedu, you know. I can tell you the things we take. And then, so if you're going to develop like a food table, kind of, for me, then you can look at all the things I eat and you can slot it in. So when I see it, it's normal for me to be able to, you know, I can look at it and say, oh, I can do this way, I can eat this crayfish this morning with this, with vegetables. But a situation where you don't have that, in public health institution, like you said, many times what we see is there's a disconnect. The medical personnel are here, the community members are here. So for you now, you come in, I remember when I was growing up, one thing that we used to hear is when the doctor writes on the prescription sheets, you're not expected to know what is there. You're not even expected to see it. All those things are things that should change. This is what you're going to consume. This is what you're going to be taking in. You have a right to know what is this and why is this.
That disconnect is what we would want to see, especially with regards to Ebola.
Yeah.
So are you satisfied with what we have now in our border points, at our airports, or what we're doing in our schools now?
Well, one thing I know is that we can be better. But based on what we have now, believe me, I think Nigeria has gotten to that level where we can be emulated. Now you see schools, even public schools, where people are being told to wash their hands and all. Now what is going to determine whether will be evaluated on this particular basis is what happens in the next 1 year, 2 years. What do I mean by this? Whether we like it or not, we know that hand washing prevents a lot of things. Diarrhea, it prevents this, you know. So by the time we are encouraging hand washing in schools because of Ebola, and now, as of yesterday, we were declared Ebola free, we are still supposed to be on guard, right? But the truth about it is, now with this, why not just continue this particular habit? Many people do it at home now. Many people do it in offices. We do not need to let this particular culture go. It's a culture that is good. It's a culture that we can imbibe. So for every company you go to, for every school you go to, let them wash their hands. Yeah. Let the government, local government, state government, start to provide allowances for water, for soaps, so that these children do this as, you know, it becomes a habit. And by the time we look at 6 years, 1 year, it becomes a habit in school. The same way we look at school health program is just for us to be able to consolidate the school health program and say hand washing is something that must happen in every school.
The other part where Nigerians want to see us continue this unity is the health sector. Can they all pull together and keep working together?
Well, for me, one thing I realize is the fact that with respect to everything that has been happening in the health sector, I think that it's something we can all decide, like a roundtable session. Now, what do I mean? One thing that I continuously say is the fact that social capital has been lost in the health sector. The medical personnel is not satisfied with what he's getting. I'm doing this kind of job, I'm doing this amount of, the workload is so much, and I'm getting this. The other personnel are feeling, oh, what are you getting? We are getting less, you know. And basically, the only thing I see is the fact that we have that lack of communication. We are not communicating. We are not looking at ourselves as a team where everybody has a sense of duty, and the success of one team member actually is the success of the second team member. Now, for this Ebola, we realize that the virologist, the public health physician, the clinical physician, the social worker, everybody now can go back to say and say, yes, I was part of the team that made it work. I was part of the team that made this work in Nigeria. I can write my name in that legacy, in that gold, in that golden place that, yes, I was part of that team. So now the truth is, if we could do it for Ebola, we can actually do it for a lot of things. The very first thing we need to do is to be able to understand that we are all different personalities. And at the same time, we should have a common goal. And this common goal is the health of the populace. The health of the populace, we want to be able to at least help with the health indices of Nigeria. We want to make it better. How do we make it better? Definitely we will all have issues. But then when we have issues, I do not think it is in the best interest of everybody for another section to use that as a leeway to be able to act as a victim. Basically, I think we all have our own associations. We should be able to live together and be able to work together as the medical community in Nigeria.
All right, that's all we have to let it go today. Dr. Noimath Balogun is a public health personnel. Thank you very much for coming on this morning.
My pleasure. Thank you.
We'll be back after this break. Please join us again.